morning. Nice to meet you.
Good morning. My name is Olga Shkolna. I'm a plastic surgeon from Odessa, Ukraine.
She's from Ukraine. I'm very happy to see her. After my presentation, she asked me several questions about hybrid breast augmentation, how I manage the fat, how I put the fat in. Is there any other question you want to ask?
Okay, how long your operation just for primary breast augmentation? How long?
So it depends on the incision area where I'm going to put the incision. Usually armpit, I have to use the endoscope, takes around 50 minutes. If it's under the breast, IMF incision, it takes around 35 minutes to 40 minutes. But I have to do a very clean dissection in order to prevent bleeding. And also, if the time is too long, I might have a percentage of having infection. So I try to shorten the operation time as short as I can, but I'm not in a hurry every time because I try to make a small incision, usually around 2.5 centimeters under the breast, and if I go through the axilla, 3.5 because I have to go with the endoscope. But at the last point, I apply the skin bond in order to make a waterproof, skin-tight closure.
My operation time for primary breast augmentation is for about 1 hour. It can be also 1.5 hours because I also make good hemostasis and I want to be sure that everything is okay.
Yeah, so I think breast augmentation, it doesn't matter with time, but I think very closely doing the dissection is very important for the safety. I got that question from Dr. Boti, how I manage the mold position of the Motiva implants. I always have a concern with that too. In Korea, we are not able to use anatomical or texture type. So
Not use?
no.
Oh,
So-
very interesting.
Yeah, so that's why we have to rely on only dissection area. So that's the hardest thing in my practice. Do you do a lot of hybrid breast augmentation?
A lot of hybrid breast augmentation. Truly, I do just breast augmentation or breast lift with breast implants in one time. But if I see that something that I need some volume for about when the girl have asymmetry and breast ptosis, I said to her, let's lift your breast, let's make implantations, and then we will see in 6 months, maybe we will have a little bit sleeper feeling.
Okay. Oh. I usually do like 1/3 or 2/3 of my patients usually because Asian people have small physics and their body is very small.
I think we have difference in body of Asian women and European women, so this is the point. I would like to ask you, do you see some patients who have Ozempic or something like this, and do you use their fat? Because I have one case, a girl have Ozempic, and her fat, she has no fat. It was bad.
Well, it's not still popular in Korea, Ozempic or Wegovy or Mount Zero. So we don't have that 0% of fat. Even though they're skinny, they have at least 50 cc usually. So I try to gain fat from their inner thighs or lower abdomen and have it all inserted to the breast area.
Do you use drains?
Oh, usually no. I used to use drains 7 years ago, but I did my experiment for my practice. I try to follow up the patient who don't have drains, and I follow with using the ultrasound. So after I see the patient after the surgery, within a week, even without the drains, there's very minimal accumulation of blood inside. So even though you have drains inside, if you take it out, minimal bleeding might occur. But I think because of drain, it has negative pressure inside. So that negative pressure also stimulates the vessels to have bleeding coming out.
Yeah, I agree with you. I also try to don't use drains, but sometimes when it's very bleeding, I use it, but usually no. I also agree with you that if we have hematoma, we will see it, and drain can not help us.
Oh yeah. But I sometimes use in secondary cases. If I do total capsulotomy, I make a new space inside. That space might have a little bit oozing of the bleed. So in those kind of cases, I use drain.
Yes, in secondary cases, I also use drains. How long you recommend to wear compressive bra?
So it depends on the size and the shape of her chest. There are 4 categories of chest shape. One is flat. So even even though women lay down, the implant doesn't go anywhere. It just stays and facing the ceiling. But some people who have like a protruded chest wall, when they lay down, the implants goes to the outwards. It's hard to make a firm position. So in those kind of cases, I use the compressive bra 3 months while they are sleeping. During the daytime, when they go out and do their I don't recommend to do compressive bra, just wear non-wire bras. That way they'll feel more comfortness after the surgery. What about you?
I recommend to 6 weeks after operation and then for about 6 months in the night. And when the girl come to the gym, I also recommend to compressive bra for 1 year.
When they're sleeping or?
When they sleep in 6 months after surgery, I recommend. And for the sport, for gym, 1 year after surgery.
Oh, okay. For my case, sometimes recommend to wear a sports bra 1 month.
Yeah, I agree. Sports bra is also okay.
I've never been to Ukraine. I think the war is going to end very soon. Can you introduce, explain of your country?
Ukraine is a very beautiful country, and I invite you when the war ends. Please come to Odessa. It's near the Black Sea. Very beautiful architecture and very interesting multi-international culture. You will like it. So welcome in Ukraine.
Oh yeah. If the war ends, I'll want to visit your clinic as well.
Yeah, super. We will show us masterclass in our clinic.
I'll be very honorable.
Super.
It will be an honor for me. Oh, thank you for your interview today.
Thank you too.
I hope to see you soon again.
See
in the
you.
future.